We're doing an emergency evaluation petition. Basically, somebody went to the court and stated that they feel that somebody is a threat to themselves or others. So it is our responsibility to transport them to the hospital and give them to the care and custody of the nearest hospital so they can have a mental evaluation done on them.
Nationally, it's estimated that 1 in 10 of all law enforcement responses involve a person with an untreated mental illness. And since COVID-19 hit, those numbers have gone up.
You want people to use nonviolent means.
Councilmember Tom Hucker says that needs to change.
This is a national problem that's been going on for decades. We have thousands of residents who are undiagnosed and untreated, and many of them get into psychological crises. And unfortunately, not just in Montgomery County and other counties as well, the only professional staff we have to send to them is an armed police officer. So that doesn't make any sense.
Hucker says many calls that result in arrests can be addressed by a mobile crisis team. Up until last week, there was funding for only one of these teams here. But now, with an additional $600,000 in funding recently approved by the council, 6 new staff members will be added to expand the response for these situations.
We've been weak on mental health for a long time, better than most counties. We need to get better, and the special appropriation allows us to hire 6 social workers to start with to create these teams and spread them around the county, probably co-located in firehouses or other government facilities, so they could get to a crisis very quickly.
Beth Loftus and Cynthia Maya are mobile crisis team members here in Montgomery County. The mobile crisis team provides immediate 24-hour-a-day, 7-day-a-week assistance with psychiatric emergencies in the home, schools, or elsewhere. The team was preparing to go out on a call involving a barricade situation where weapons were involved.
The police went there, the brother met them.
In this situation, because weapons are involved,
Do they have a history of violence?
the police would provide backup.
Our protocol is that we go out to the residents, and then once we're on scene, we call dispatch, and then police come to assist us. In this specific case, we really value our partnership with police. An 82-year-old male who's barricaded himself. There are weapons. They would clear the scene for us and make sure that it's safe and that the weapons are removed. So we do the mental health piece, and then, they make sure we're safe and that the community member is safe.
Sometimes the team is called by the police to assist with a call, and other times the crisis team is first on the scene. Either way, the crisis team workers say the additional funding from the council will be a game changer.
It's going to make a big difference. It's going to be helpful. Again, we can get calls out quicker. Usually we have 3 calls coming at one time, and we have to prioritize whichever one, it's more acute. It'll allow us to be able to meet with the family for a longer period of time, because when you have 2 other calls, sometimes you have to speed things up a little bit.
Councilmember Hucker says he believes having a mental health professional on these calls will go a long way in helping to prevent police shootings in the future. And with the continuing COVID-19 crisis, he says the timing couldn't be better.
There's acute economic stress right now, and lots of personal, interpersonal, familial stress as well. I mean, so many families are just stuck in the same house together. And, many of us have a job that allows us to work from home. Many people don't and are putting themselves, at risk on the front lines. But a lot of families aren't very cohesive and aren't very safe. And when you have families cooped up together that have a history of violence, that's a recipe for trouble.
The council is requesting an interim plan for the additional crisis team members by September. Reporting from Rockville, I'm Susan Kennedy.